So those are excellent talks, just really summarizing kind of the breadth of data out there and what we think about when we think about early stage lung cancer. And so for me, I just wanted to start perhaps in determining, because I know that everyone has different backgrounds, different levels of expertise, kind of defining some of the terms that we talked about. And so one term that came up quite a bit was kind of neoadjuvant, perioperative, adjuvant. And so how do we think about those things? How do we define those terms? And then what is the difference? Like in your clinical practice, is there an advantage to one approach versus another for a patient or even biologically? And perhaps we can start with Dr. Das for that one.
Yeah, I think it is confusing. So we think about sort of neoadjuvant treatment being treatment that's given before surgery. We think about adjuvant treatment being treatment that's given after surgery. And we think about perioperative treatment really being both of those things. So patients being referred for treatment both before and after surgery. And I think that's, so just the terminology there, I think is important. And I think really kind of one of the big questions as we think about all the trials that we have neoadjuvant trials, we have perioperative trials, and we have adjuvant trials. And so I think we need to really think about which patients should be getting neoadjuvant alone, which patients should be getting adjuvant alone, and which patients should really be getting a perioperative, both the neoadjuvant and adjuvant treatment course.
I think very, very well said.